Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern. And we're going to attack a couple of topics today. The first one is we came across a news story that was talking about the metric system versus the US based system we have here known as the Imperial system. And one of the topics in there was about doctors notifying us of risks when trying to prescribe doses or in dosing, and maybe Dr. Stern could help me out here with this. What are doctors talking about when they talk about the use of the metric system versus the imperial system when prescribing medications?
The issue that we have here is the following. In the United States, in the English Empire, what we're dealing with is an English system where we have feet and miles and quarts and gallons and things like that.
Mm-hmm.
In the metric system that's used in science that individuals like myself and otherwise kind of grew up with, we're dealing with milligrams and grams and kilometers and things like that.
Mm-hmm.
The metric system is a very logical system tied up with mathematics that deals with things that are in relation to tens, hundreds, thousands. But effectively, when doctors talk about it, they're saying children, for example, are getting doses of 5 milliliters or 5 mLs or
Mm-hmm.
10 mLs or something like that, and syringes that are set up in a similar way. That's pretty standard for anybody that's in science or in medicine or pharmacy or otherwise. Clearly, parents who use it already see it on the cup. They see that it's 5 mLs or 10 mLs, and when they know what that means, they still know it's 5 or 10
Right.
on the syringe or what goes on. So that's what they're talking about.
Okay. Well, we can attack that topic in more in depth if you leave a comment below and let us know if you want to know more information about it.
Can I
Oh,
interrupt
go ahead.
something? Let me just add one thing to this. I think the issue came up about the fact that there's some issues with regard to medication errors in children because of the problem with conversion of English to metric. And I think that the metric issue is fairly well described. The thing that we need to be careful about is that it's very easy for us to point the finger and say this is a doctor problem, a patient problem, a nursing problem, a pharmacy problem, whatever.
Right.
In this particular case, in what we're talking about, this is an issue of communication between everybody. So it's not just a matter where we point the finger and we say that one group has a difference or otherwise. What we're dealing with is everybody's involved, and bottom line is everybody needs to communicate so it's very clear to the parents what the dose is supposed to be, how to look for it, what to see so that they know exactly what to give, and then we begin to minimize these kind of problems as much as possible.
Right. Well said. And also, we're gonna move on from another topic, but if you want to know more, please feel free to comment. We'll message right away. We wanted to attack another topic which involves access to healthcare, and I'm sure a lot of you are aware about the Huston flooding and well, it's actually all of southeastern Texas, right?
And
It's about
Louisiana now.
Yeah, Louisiana now. And a big topic in there is that the patient's ability to access healthcare, where I believe the size that was attacked by this hurricane is about the size of Michigan. I read in one report. So trying to find places to where a patient can receive their medicine is really tough. So what is the protocol for most of these doctors to be able to still provide adequate health care to most of these people?
Yeah, there are a host of different protocols that have been established in every state, every country, about what to do when there's a major disaster, be it a flood or a earthquake. And by the way, we should say as individuals, as healthcare providers and the rest, that our hearts and our interests go out to everybody and all families that are involved. We and everyone else are making contributions to that. But we're all people, we all care, and whether it's one kind of natural disaster or another, it's really among all of us versus just one of us.
Right.
With regard to this, the protocols of what goes on is that people plan for this. So they set up what are known as emergency boxes of medications so that they have that available when people are really sick or they can't get to the hospital or they have to do something emergency. Boxes like this are commonly carried by paramedics and fire departments, etc. If people are in remote areas, they oftentimes have these kind of boxes that they fly in or maybe boat into these areas on some sort of a regular basis. Furthermore, the real issue is that when there's a disaster, you need to make sure that everyone has a medication for their acute needs, for what they need right away,
right,
for the next several days or whatever, and then what they're going to do on a long-term basis. In the immediate area, that's where people begin to bring things in or fly things in so that they can dispense it. And almost, I believe every state, really, I haven't looked at it recently, but every state has something where pharmacists can dispense emergency amounts of medication to people without a prescription, so that if they come, or a pharmacist that doesn't know the patient, doesn't know the individual, or otherwise can still dispense several days or weeks of medication to someone for their high blood pressure, their diabetes, their hyperlipidemia, or whatever the indications are, so that they can have those drugs. And that's very common, in the states and the federal government have all addressed that and realized it, and they make sure that those are accommodated for. Finally, and probably not finally, because everybody's involved in this, from the Red Cross to the FEMA and every kind of group that's involved, from churches and temples and everybody that's involved in this, Salvation Army. What they do is they have emergency quantities and amounts that they bring in, and so they're busy surveying people in order to find out what they need, what they can have. It's also true that now today, different from prior times, there is social media. So if someone has it and they can get to a phone or they can get to some mobile area, they can message out that they need something, and that message can be contacted from the acute care areas, and they can bring that medicine or that information in if it supplies or otherwise. So nothing is perfect, nothing works well, but this is really based on pre-planning, and if we don't pre-plan, then these things don't work at all. So it's terribly necessary, and everybody's tried to do things for floods, for earthquakes, for dams breaking, and every other kind of consideration,
right,
to try and make sure that people have some sort of medicines, and that the appropriate professionals have a leeway so that they can go in and deal with these problems, even if they don't know the patient, they don't know the doctor, they don't have prescriptions, stuff like that.
Right, right. And it's good that they do pre-plan, but it also comes from us being not prepared before. I believe Katrina was a big problem with that, and then you plan ahead for things like that because you know another one's going to come. And I'm sure there's more lessons to be learned from what's going on right there in Houston. And as Dr. Stern says, our hearts go out to the families and those that have actually passed away. I believe we count as 20, and our hearts go out to their families as well. And in another area of the world, Venezuela, there's a lot of political turmoil, and a lot of families are being affected down there as well. And another story that came out of there was the people there don't have any access to healthcare. There's very few healthcare products coming into the country, and I'm just wondering, how do doctors down there in Venezuela, how can they handle issues like this where they can't get the medicine in and they can't provide care to the patient? How does a doctor plan for situations like this?
Well, it's really hard to plan for that. If you don't have access, you can't get to a hospital, or you can't get to pharmacies or otherwise to deal with it. It's really handled in a couple of ways. One is that the government themselves and perhaps local communities plan ahead and have some sort of stockpiles and boxes, as we've talked about, that has both emergency meds as well as some maintenance meds. Secondly is these wonderful groups like Doctors Without Borders and others are there, and they fly in and frequently help. And then there are individual groups that get volunteers of physicians, nurses, pharmacists, etc., to fly in with drugs, with supplies, with devices, etc., that they can do to help. So it's not just a one group area, and hopefully they have done something to have some storehouses of drugs and devices, but also it's everybody's problem, and everybody then becomes part of the group that tries to solve these problems, bringing in professionals to deal with it. Even if it isn't a disaster, there are many of these groups that come in on a regular basis and bring surgeons and bring pharmacists and bring appropriately trained nurses, etc., to try and deal with these things, even if it isn't a disaster. So if it is a disaster, those groups can be recruited and they come in order to deal with it. And frequently it's all on voluntary time, so they're all trying to get there to help people and deal with that kind of thing. This is the kind of thing where one person isn't alone. I know in today's world it's me, and everyone else will have to deal with himself. But in these kind of things, it's not about me. It's about people trying to help other people, and people from other countries, people from other areas coming in order to help what's going on.
Yeah, and as you mentioned, the groups are really big in helping those that don't have access or don't have the help that they need. These groups like Doctors Without Borders are able to provide care, and it's a wonderful thing. And it's also not very how do you say, they don't shut people out. They're very inclusive, and they're looking for volunteers. They're always looking for help, as well as the people down in Houston. They're always looking for help. So if you're seeing this and you want to figure out how you can help, there are text messages that you can send to donate. I think $10 I think is the minimum that you can send, or you can send any amount. That's all we have to talk about today, but if you would like to know more, please like, share, and leave a little comment. We provide videos every Wednesday, and if you want to know more, you can message us directly as well. You don't have to leave a comment, you can leave a message. And that's all I got. Anything, Craig?
No, I think that's it. Have a wonderful, wonderful day. And for those that are in trouble, please, in any way that anybody can, this is really, if everybody gives a little, then there's a lot that's available. It doesn't mean that everybody has to give a lot. Even if you give a little, whether it's money, whether it's resources, whether it's help, anything you can do are things that will help people to get what they want.
Well said. And we'll see you next week.